Well, one of the things that my wife and I, one of the reasons when we started the company is my wife and I are on board with doing a lot of things for the community.
Yeah.
Houghton Physical Therapy sponsors a lot of events, and again, that goes back to the way I was raised, is that we want to help people.
Yes.
So we're in the business to help people directly in physical therapy, but having the business, Amy and I are able to help out and reach out to help out more people in the community. We support local golf tournaments, we support local health fairs, we support local road races.
What about senior center? Haven't you done things for the
Yes,
senior center?
yes, we have. Over the years with the Attleboro Senior Center, we have worked with them. We've sponsored some events. We've had some therapists go over and give some talks.
Yeah.
Over there at the Council on Aging with Madeline McNeely. She's fantastic to work with.
Right.
We support, it's really important to Amy and I to support as many things as we can. We have a coat drive that we support New Hope with, and that is towards the winter, just around Thanksgiving.
Right.
And we had well over 100 coats that we were able to get last year, which is fantastic.
Well, that's great. That's wonderful. Now, do you belong to any state associations or national associations at all?
Yes, I belong to the American Physical Therapy Association, which is a governing body of physical therapists, which is very important for all physical therapists to be part of that.
Yes.
Because with the insurance changes and some of the regulations, we really need to be up on how it's going to affect our profession.
Yes.
And I'm also a member of the National Strength and Conditioning Association, and I am a certified strength and conditioning specialist. And that is someone who has a minimum of a bachelor's degree in a science-related field and has sat for an exam to be a strength and conditioning coach or a personal trainer. And I'm an Eagle Scout as well, and I'm on the executive board for the Anawan Council.
Yes.
For the Boy Scouts of America, which I really feel strongly about.
Yeah.
And having 3 girls, that's probably the closest I'm going to get to be hanging out with the Boy Scouts.
Okay. Yeah, well, before we started this interview today, you told me how you go down to Middleborough for camping weekends.
Correct.
With your kids, and that's just great. Now, I read that your profession, there's great demand for physiotherapists, and that it will double by the year 2018 or something as to the number of physical therapists. And a lot of that has to do with our aging population.
Correct.
And as their needs come up. And so this is true. Now, I'm just curious, how do you selected, because you have people who are physical therapists.
Correct.
And you have some that are assistants, correct. Assistant therapists. How did you get the ones that have the title of physical therapist?
Well, when I first started off, we started putting ads in the newspaper to try and get physical therapists. And you're right, as the demand is growing for physical therapists, we've had to go to a few different avenues.
Yeah.
We actually have a system where internally we actually send out letters to physical therapists,
Yeah.
To try and see if they would have any interest in being part of our team.
Yes.
One of the things that I know at Houghton Physical Therapy is that all the therapists work really well together.
Yeah.
And if one of my patients has an issue that's not getting better after a few visits, I'm going to refer them in-house to another physical therapist.
Right.
Because it's just about us getting the patient better. It's not an ego thing. It's about doing what's best for the patient.
I think that's the attitude they give. Matter of fact, they may swap off to somebody.
Correct.
Because they can do something that person can't do as well.
Correct. And through this interview process, we have found some magnificent, unbelievable physical therapists and physical therapy assistants and physical therapy techs to work with us. And it's a really team-oriented approach, and the feel that we want people to have when they come in to the office is to feel a place of comfort.
Right.
Because we do know, like you said, people are oftentimes coming in a lot of pain. So number one, getting them to feel comfortable, getting them to trust us. And at that point, patients could pretty much come in and see any one of our therapists and feel and just get excellent care.
As they go into training, are there particular colleges or universities or something in the area that specialize in physical therapy?
Yes, there are. There are quite a few. There are physical therapy assistant programs, and there are physical therapist programs. Right now, it's a doctorate program. So for someone to go to college, they have to get their doctorate in physical therapy. Some of the local colleges for that are Boston University, University of Vermont, Springfield College, I know there's a few others as
Now, why
well.
would a doctorate be? Is it necessary or not? I don't follow there.
Well, what they're having now, it's an entry-level doctorate program, and the difference between the doctorate program is in school they're teaching them, they have to do a dissertation, and they're teaching them to read x-rays and read some MRIs.
So it goes beyond what you would get as a bachelor then.
Correct, yes, it certainly does, and
Right.
that's how we talked about before, Massachusetts being a direct access state.
Yes.
So when physical therapists can look at x-rays, can look at MRIs.
Good.